So I'm here at the ASH 2023 meeting presenting on behalf of my co-investigators results from the PREAMBLE registry. The PREAMBLE registry is one of the largest prospective registry in multiple myeloma, and we have had a number of publications in the past on a diverse variety of subjects. Patients in this registry represent individuals from both the United States and from several countries in Europe. Over 2,200 patients have been enrolled, and the subject of this abstract was looking at the results of lenalidomide maintenance after transplant as first-line therapy in patients with multiple myeloma. There were 102 patients that were reported on. Of these, about 3/4 of patients got monotherapy with lenalidomide, and a fourth of patients got a variety of combination regimens. What we see in our presentation is that the patients on an average started their maintenance lenalidomide about 3 to 3.5 months after the transplant, and these patients had a median PFS of about 2.5 years, which actually is something that tells us that we need better therapies for patients on lenalidomide maintenance. In the future, we'll hopefully have better maintenance options. And we also reported on a variety of salvage strategies post lenalidomide that were employed, and these were mainly CD38 antibodies in addition to other drugs. So this reflects real-world experience with our contemporary patients. The cohort was accrued between 2012 and 2023. So it is something that supplements the data that we are getting from prospective clinical trials and is very relevant in this era where real-world evidence is acquiring new importance.